Don't tattoo your eyebrows just yet. If your eyebrows have become thinner, patchier, or almost disappeared after the age of 60, the answer may not be another expensive serum, microblading appointment, or complicated supplement routine. Before you spend $500 to $800 on a semi-permanent cosmetic procedure that might fade unevenly, change color, or leave you with a shape you cannot adjust, there is something much simpler, much cheaper, and much safer you should try first. And I am not talking about another overpriced brow growth serum sold in a tiny tube for $40. But I want to be very clear from the beginning because I do not believe in false hope. There is no magic oil that can guarantee new eyebrow growth overnight. There is no single product in the world that can regrow every lost brow hair in 7 days. And anybody who tells you otherwise is not being honest with you. What there is, however, is a simple, natural oil that may help condition fragile brow hairs, reduce dryness and breakage, and support a healthier environment around the follicles when used correctly and consistently over several months. And when you combine this oil with the right approach, you may be surprised at how much fuller and healthier your eyebrows can look. And there is another part of this story that most people completely miss. Sometimes thinning eyebrows are not simply a normal part of aging that you have to accept. They can be connected to nutritional deficiencies, thyroid changes, inflammation, skin conditions, or repeated plucking over many years. Ignoring the root cause while applying products to the surface is like painting over a crack in the wall without fixing the foundation. Eventually, the problem shows itself again. I am Dr. William Lee, and I have spent over 3 decades studying how the human body heals, repairs, and protects itself. I am a medical doctor trained at Harvard, and my research on angiogenesis, the way the body grows and maintains its blood vessels, has been published in major scientific journals, including Science and the New England Journal of Medicine. I wrote the book Eat to Beat Disease, which became a New York Times bestseller, because I believe that the right information, grounded in real science, can change how you age. In my decades of studying the body's natural defense and repair systems, I have seen something remarkable again and again. The health of the tiniest blood vessels in your body, the ones that deliver oxygen and nutrients to every single hair follicle on your face, matters far more than most people realize. And the condition of those blood vessels is influenced by what you eat, how you treat your skin, and whether you are addressing underlying health issues. Today, I am going to explain the one oil people commonly use for thinning eyebrows, how to apply it safely, what it can and cannot do, and the 5 biggest mistakes that may be keeping your brows from looking fuller. And I want you to stay with me until the very end, because the final step is not the oil. The final step is the part that tells you whether your eyebrow thinning may need medical attention, and ignoring this signal from your body could mean missing something important about your health. Let me begin with the story of a woman I will call Margaret. Margaret was 74 years old, a retired school teacher from Portland, Oregon. She had taught 4th grade for 37 years and retired with a shelf full of handmade cards from her students. For more than 3 decades, she had shaped and plucked her eyebrows in almost exactly the same way, a neat defined arch that she maintained with tweezers every few days. At first, when Margaret was in her late 60s, she noticed only a few missing hairs near the outer edges of her brows. The tail ends were not as full as they used to be. She thought, well, that is just what happens when you get older. She started filling in the gaps with an eyebrow pencil every morning, spending an extra 3 minutes at the mirror. Then the spaces became wider. The arch that had defined her face for most of her adult life was now something she was drawing on with makeup. She bought a $30 eyebrow serum, used it for 6 weeks, and saw almost no change. Then she tried a $45 serum, and it irritated the skin around her eyes so badly that she had to stop after 4 days. She considered microblading. She went to a consultation and was quoted $700. The technician showed her beautiful before and after photos and told her the results would last up to 2 years. But when Margaret looked closely at the fine print, she learned that microblading does not stop existing hairs from thinning further, it simply adds pigment in the spaces where hair used to be. The underlying issue, whatever was causing her eyebrow hairs to weaken and fall out, would remain completely unaddressed. Margaret did something smart. Before booking the appointment, she looked at her eyebrows in natural daylight with a magnifying mirror. The skin underneath her brows was dry. It had small flakes. Some areas were slightly pink from irritation, and she realized that for decades she had been plucking, waxing, exfoliating, and applying products to this delicate area without ever asking what her follicles actually needed to stay healthy. Her first step was not a cosmetic procedure. She completely stopped plucking her remaining brow hairs. She simplified her skincare routine and stopped using retinol and exfoliating acids anywhere near her eye area. She began using a very small, carefully tested amount of castor oil as a conditioning treatment, applied with a clean spoolie brush. And this part is critical. She made an appointment with her doctor to check her thyroid function, iron levels, and vitamin D status. Over the next 4 months, something changed. The hairs that were still growing looked healthier, darker, and less brittle. The skin underneath her brows was no longer dry or flaky. She did not suddenly grow a completely new pair of 25-year-old eyebrows. That is not a realistic promise, and I will never make it. But the combination of less irritation, less breakage, protecting the hairs she still had, and addressing the nutritional deficiencies her blood work revealed, made her brows appear noticeably fuller. She went back to using an eyebrow pencil, yes, but she needed much less of it. And she never did get the microblading. That distinction matters enormously. The goal here is not to sell you a miracle in a bottle. The goal is to understand what your follicles may actually need, protect what is still growing, and rule out the medical causes that no cosmetic product can fix. Now let us talk about castor oil. The oil most often discussed for eyebrows is cold-pressed castor oil. It comes from the seeds of the castor bean plant, Ricinus communis, and it has been used in traditional medicine for thousands of years. The key component is a fatty acid called ricinoleic acid, which makes up approximately 90% of the oil's fatty acid content. Castor oil is unusually thick compared to most cosmetic oils. When you apply a tiny amount to the eyebrow hairs, it forms a protective coating over each hair shaft. Think of each eyebrow hair like a very thin, fragile thread. If that thread is constantly exposed to dry air, rubbed by your pillowcase at night, pulled by tweezers, or coated in drying makeup products, it can weaken and break before you even notice how much length and density you have lost. A conditioning oil like castor oil may reduce the feeling of dryness and help protect the hair shaft from friction and breakage. When the hairs are less brittle and better conditioned, they can grow longer before naturally shedding. Longer hairs mean more visible coverage of the brow area. But let me be very precise about what the scientific evidence says. A study published in the Journal of Cosmetic Science examined the effects of castor oil on hair and found that it can improve hair luster and reduce moisture loss. However, there is no large, randomized, controlled clinical trial that proves castor oil stimulates new hair growth from dormant follicles, specifically on the eyebrows. Castor oil is not the same as a proven hair growth medication like minoxidil. It does not contain prostaglandin analogs, which are the active ingredients in prescription eyelash growth serums. It does not automatically restart every inactive follicle. It does not reverse every cause of eyebrow loss. And it should never replace a medical evaluation when thinning is sudden, severe, or associated with other symptoms like fatigue, weight changes, or skin rashes. So why do so many people feel their eyebrows look fuller after using it consistently for several months? There are several possible reasons based on the physical properties of the oil. First, it can make existing hairs appear darker and more defined by coating them with a thin, glossy layer that reflects light. Second, it can reduce the appearance of dryness and flaking around the brow area, which makes the skin look healthier. Third, the conditioning effect can help individual hairs lie together smoothly instead of separating into sparse-looking gaps. Fourth, if breakage from dryness and friction was the main problem impeding visible fullness, then protecting the hair shaft through conditioning gives those hairs more time to lengthen before they naturally shed. A hair follicle goes through three phases. The anagen phase is the active growth period, which for eyebrow hairs may last only 30 to 45 days, compared to years for the hair on your scalp. The catagen phase is a brief transitional period, and the telogen phase is the resting and shedding period. At any given moment, a significant percentage of your eyebrow follicles are in the telogen phase, meaning they are resting, not actively producing new hair. Castor oil alone is unlikely to force telogen follicles back into the anagen phase. But by protecting the hairs that are in the active anagen phase from breaking prematurely, you are maximizing whatever growth capacity your follicles still have. That is the honest biology. Here is the simple protocol. Use a high-quality cold-pressed castor oil, hexane-free and organic if possible. You will also need a clean, dedicated spoolie brush or a package of cotton swabs. Do not use the same brush you use for mascara. Every evening, wash your face gently with a mild cleanser and pat the eyebrow area completely dry. Take the spoolie brush and dip only the very tip into the castor oil. You want one tiny drop at most. The amount should be so small that the brush feels barely damp. Brush the oil through your eyebrow hairs, always following the natural direction of growth, from the inner corner near your nose outward toward the temple. Use gentle, short strokes. Do not press hard. Do not scrub. Do not saturate the skin underneath until it is dripping. This is one of the most common mistakes I see. People pour oil directly onto their fingers, then smear a thick layer across their entire brow area. That is not more effective. It is wasteful and increases the risk of the oil migrating into your eyes while you sleep. If the oil enters your eyes, it can cause blurry vision, irritation, and a greasy film that takes hours to clear. Keep the application strictly on the brow hairs and avoid the eyelid margin entirely. If you wake up with the oil in your eyes, reduce the amount even further the following night. Use this treatment once daily for at least 8 to 12 weeks before judging the result. Eyebrow hairs grow slowly. Measuring improvement in days or even a few weeks is unrealistic. Before using the oil regularly, you must perform a patch test. Place one tiny drop behind your ear or on the inside of your arm and wait a full 24 hours. If you notice any redness, burning, swelling, itching, or a rash, do not use this oil near your eyes. An allergic reaction on your arm is uncomfortable. An allergic reaction on your eyelid is serious. And please do not use castor oil if you have an active rash, open skin, an eye infection, significant eyelid swelling, or any known allergy to castor plants. Speak with a healthcare professional first. Now let us get to the 5 mistakes that may be keeping your brows from looking fuller. Understanding these mistakes is more important than the oil itself, because if you are making them, even the most expensive product in the world will not help you. The first mistake is plucking too aggressively and too frequently. This is probably the most common cause of gradual eyebrow thinning in women over 60. For 30, 40, or even 50 years, many women have been shaping their eyebrows by removing the same hairs again and again. They use tweezers, wax, threading, or depilatory creams to maintain a specific shape. The problem is that each time a hair is forcefully pulled from the follicle experiences mechanical trauma. This trauma triggers a low-grade inflammatory response around the follicle. Over weeks and months, this is not a problem because a single pluck is a minor event, and the follicle usually recovers. But think about what happens when this is repeated thousands of times over several decades. The cumulative trauma can cause some follicles to produce thinner, weaker hairs over time. With continued trauma, some follicles may produce only fine vellus hairs, and in some cases they may stop producing visible hairs at all. A study published in the Journal of the American Academy of Dermatology noted that repeated traction and plucking can, in susceptible individuals, contribute to a condition called traction alopecia, where chronic pulling leads to hair loss. This is more commonly discussed in the context of tight hairstyles on the scalp, but the same principle applies to eyebrow follicles. For the next 3 months. Leave your brows completely alone as much as you possibly can. Do not reshape them every few days. Do not chase every single stray hair with tweezers. Do not visit the threading salon. Let the natural pattern reveal itself. Only trim very long, unruly hairs carefully with small scissors if they are truly bothering you. But removing hairs from areas that already look sparse is the absolute worst thing you can do. The second mistake is using too many products on and around your eyebrows. The average woman uses anywhere from 5 to 15 skincare and cosmetic products every single day. Cleansers, toners, serum, moisturizer, sunscreen, primer, foundation, concealer, setting powder, brow gel, brow pencil, makeup remover. And that is before we even talk about active ingredients like retinol, glycolic acid, salicylic acid, vitamin C, niacinamide, and peptides. The skin around your eyes is among the thinnest on your entire body. The epidermis in this area is approximately 0.5 millimeters thick, compared to about 2 millimeters on other parts of the face. It has fewer sebaceous glands and a less robust barrier function. This means it is much more susceptible to irritation from active ingredients, fragrances, and preservatives. When the skin around your eyebrows becomes irritated, even mildly, you may unconsciously rub, scratch, or touch the area more frequently. That additional friction can weaken hairs that are already fragile. The irritation itself creates a low-grade inflammatory environment around the follicles, which is not conducive to healthy hair cycling. Your brow routine should be boring, and I mean that as a compliment. Gentle cleanser, pat dry, clean spoolie brush, one carefully chosen conditioning product, nothing more. Stop using retinol, exfoliating acids, and harsh active ingredients anywhere near the orbital bone, which includes the entire eyebrow area. Also, avoid putting undiluted essential oils anywhere near your eyes. I understand the appeal of natural remedies, and many essential oils have genuine therapeutic uses when used properly, but natural does not automatically mean gentle. Tea tree oil, peppermint oil, rosemary oil, eucalyptus oil, cinnamon oil, and other concentrated essential oils can cause significant irritation to the delicate periorbital skin. Some can cause chemical burns if applied undiluted, and if any of these oils enter the eye, they can cause severe pain, corneal irritation, and blurred vision. If you want to use rosemary oil for hair growth, which some studies suggest may have mild benefits comparable to low-concentration minoxidil for scalp hair, you must dilute it properly in a carrier oil at a concentration of no more than 1 to 2%, and you must keep it far away from your eyes. The third mistake is assuming thinning eyebrows are always cosmetic and never investigating a medical cause. This is the mistake that concerns me the most as a physician, because it represents a missed opportunity to detect something important about your health. Eyebrow loss can sometimes be a visible signal of an internal health issue. The classic presentation is thinning at the outer third of both eyebrows, which can be associated with hypothyroidism, an underactive thyroid gland. The thyroid hormone plays a critical role in regulating the hair growth cycle, and when thyroid function is low, hair follicles throughout the body, including the eyebrows, may shift prematurely into the resting and shedding phase. A study in the Journal of Clinical Endocrinology and Metabolism reported that hair loss is a common complaint among patients with thyroid disorders, and eyebrow thinning specifically has been recognized in medical textbooks as a potential physical sign of hypothyroidism for decades. Iron deficiency is another potential cause that is frequently overlooked. Iron is required for the production of hemoglobin, which carries oxygen to every tissue in the body, including hair follicles. When iron stores are low, the body prioritizes oxygen delivery to vital organs like the heart and brain over non-essential tissues like hair follicles. A study in the Journal of the American Academy of Dermatology found that iron deficiency may contribute to hair loss in some individuals, particularly women. Zinc deficiency, Vitamin D deficiency and inadequate protein intake are other nutritional factors that can affect hair growth. Autoimmune conditions such as alopecia areata can cause sudden patchy loss of eyebrow hair, sometimes in perfectly smooth circular areas. Eczema and psoriasis affecting the face can involve the eyebrows and cause hair loss through inflammation and repeated scratching. Certain medications can also contribute to hair thinning or loss as a side effect. These include some blood pressure medications, cholesterol-lowering statins, certain antidepressants, and some hormonal therapies. If you started a new medication around the time your eyebrow loss began, mention this to your doctor. Here is when you should see a healthcare professional. If your eyebrow loss is sudden rather than gradual over many years, if it occurs in patches rather than diffuse thinning, if the skin underneath is red, scaly, itchy, or painful, if you are losing eyelashes at the same time, or if you have additional symptoms such as fatigue, unexplained weight gain or loss, feeling cold all the time, dry skin everywhere, constipation, brain fog, or changes in your heart rate. A simple set of blood tests, including thyroid function tests, a complete blood count, iron studies, vitamin D levels, and possibly zinc, can rule in or rule out many of these causes. The oil may improve conditioning and reduce breakage, but it cannot correct a thyroid disorder. It cannot restore iron stores. It cannot reverse an autoimmune process. The body needs the correct diagnosis before it can receive the correct solution. The fourth mistake is forgetting about nutrition. Your eyebrow follicles are living tissue. They require a constant supply of nutrients to function normally. Protein, iron, zinc, biotin, vitamin D, omega-3 fatty acids, and adequate calories all play a role in maintaining the hair growth cycle. This does not mean you should immediately go out and buy a handful of high-dose supplements. In fact, high-dose biotin supplements can interfere with certain laboratory tests, including troponin, which is used to detect heart attacks, and thyroid function tests. Always tell your healthcare professional about any supplements you are taking before having blood drawn. A better starting point is a varied, nutrient-rich diet. In my book, Eat to Beat Disease, I explain the importance of using food to support the body's 5 natural defense and repair systems. What you put on your plate every day is the single most powerful tool you have for influencing your health. For eyebrow and hair follicle health, think about adding rather than restricting. Include lentils, chickpeas, and beans for plant-based protein and iron, pumpkin seeds for zinc, eggs for high-quality complete protein and biotin, fatty fish like wild salmon or sardines for omega-3 fatty acids and vitamin D, dark leafy greens like spinach and kale for iron, folate, and vitamin C, which improves iron absorption, nuts and seeds for vitamin E and healthy fats, and colorful vegetables and fruits for the antioxidants that help reduce oxidative stress and support the health of tiny blood vessels. No single food can perform a miracle for your eyebrows. But over weeks and months, a consistent pattern of nutrient-rich eating supports the environment in which your cells, including your follicle cells, operate. If you are eating a highly processed diet with very little protein and few vegetables, your follicles are not getting the building materials they need. And please stay hydrated. Dehydrated skin is less resilient and more prone to irritation and flaking. Water is the simplest and most overlooked beauty tool in existence. If you suspect a deficiency, testing is more useful than guessing. A blood test can tell you definitively whether your iron, vitamin D, or thyroid levels are low. Guessing and randomly supplementing can waste money and, in some cases, cause harm. The fifth mistake is judging the result too quickly and giving up. This is where most people fail with any natural approach to hair or skin concerns. They try something for 2 weeks, look in the mirror, see no dramatic transformation, and move on to the next product. Your eyebrows do not grow at the same rate as the hair on your head. The anagen phase for eyebrow hairs is only 30 to 45 days, and the full cycle, including the resting and shedding phases, can take anywhere from 3 to 4 months for a complete turnover. Applying oil for 10 days and declaring it useless is like planting a seed and digging it up after 2 hours to see if it sprouted. Take a photograph before starting this protocol. Use the same room, the same lighting, the same angle, the same time of day. Do not wear any eyebrow makeup in the photograph. Save the photograph with a date. Repeat this photograph every 4 weeks. Do not check the mirror 10 times a day. That creates anxiety, not better results. Compare the photographs side by side after 12 weeks. What you are looking for is not a sudden overnight explosion of new hairs. That is not realistic. You are looking for healthy, shiny, darker appearing hairs, fuller coverage in areas that were previously sparse, less flaking and dryness around the brow area. A visible improvement in the overall appearance of your brows. Now, I want to pause here and ask you something. Drop a comment below and tell me your age and whether your eyebrow thinning happened gradually over many years or suddenly. Your experience, simply written in a comment, may help another person reading it recognize that they are not alone. And when someone writes, "I am 72 and my brows started thinning after menopause," and someone else reads that comment, it creates a connection that no article or video can provide. And if you find this kind of science-backed, honest health information valuable, please subscribe to Health Bites Lab. Here we take complex medical research and break it down into simple daily actions you can actually use. No hype, no false promises, no miracle cures. Just real science honestly explained. Now, let us discuss microblading and tattooing in more depth, because I know many of you are actively considering these procedures. Microblading involves using a handheld tool with tiny needles to deposit semi-permanent pigment into the superficial layers of the skin. It creates the appearance of individual hair strokes. The cost typically ranges from $500 to $800, with touch-ups required every 12 to 18 months at a cost of $200 to $300 per session. Microblading can absolutely make the eyebrows look fuller, more defined, and more youthful immediately. Many people are genuinely happy with their results, but it is a cosmetic solution. It does not restore the underlying hair follicles. It does not address the root cause of hair thinning or loss. It does not stop further thinning from occurring. Some people experience fading and uneven patches as the pigment breaks down over time. The color can shift. Brown pigments may fade to a reddish or bluish tone. Some individuals develop allergic reactions to the pigments. In rare cases, granulomas, which are small inflammatory nodules, can form around the pigment particles. And if you do not like the final shape, it is not easy to remove. More importantly, if the cause of your eyebrow thinning is an undiagnosed medical condition, covering the area with cosmetic pigment does nothing to treat that condition. The eyes, as physicians often say, can be a window into overall health. So can the eyebrows. The outer third disappearance pattern is a clinical clue that has been recognized for generations. Covering it with pigment does not change what is happening inside your body. If you have already decided that microblading is right for you, do your research carefully. Choose a properly licensed and certified professional. Visit the studio beforehand and observe the hygiene practices. Needles should be single-use and opened in front of you. The technician should wear gloves. Ask about the specific pigments they use, what is in them, and whether they have been tested for safety. Ask to see photos of their healed results, not just the fresh, immediately after photos that always look the most dramatic. But I would ask you not to rush into a permanent or semi-permanent cosmetic procedure before you have taken 3 months to try the simple protocol I have described and, if appropriate, to get basic medical testing. You may find that simple conditioning, stopping the plucking, improving your nutrition, and addressing a treatable underlying issue gives you a result you are happy with, and you will have saved yourself a significant amount of money. There is also a simple, gentle massage technique you can use while applying the tiny amount of castor oil. With clean fingers, very lightly press and move across the eyebrow area from the inner corner outward for about 30 seconds. Do not rub aggressively, do not scrub, do not pull. The purpose is not to force hair growth through mechanical stimulation. The purpose is simply to distribute the oil evenly and apply it without friction. The tiny blood vessels around every hair follicle are part of what researchers call the microcirculation. These blood vessels, some of them no wider than a single red blood cell, deliver oxygen, amino acids, vitamins, minerals, and signaling molecules directly to the follicle cells. In my research on angiogenesis, I have seen how the health of these microscopic vessels matters throughout the entire body. But I want to be accurate with you. Gentle massage is a low-risk, pleasant way to apply the oil. It does not prove that you can create brand new blood vessels around dormant follicles or that you can regrow follicles that have been permanently lost. Do not let anyone sell you on the claim that 5 minutes of massage will bring back the eyebrows you had at age 25. The relationship between circulation and hair health is real, but overselling it as a miracle cure is not honest. What about expensive brow serums? Walk into any beauty store and you will see a dozen different products claiming to regrow eyebrows. Some contain peptides, which are short chains of amino acids that may theoretically provide building blocks for hair proteins. Some contain biotin or other vitamins. Some contain ingredients that are chemically similar to prostaglandins, the same class of compounds used in prescription eyelash growth medications. Some of these serums may genuinely help some people, but they vary wildly in quality, concentration, ingredient sourcing, safety testing, and honestly, in whether they contain anything that could possibly work based on what we know about hair biology. Here is the problem. Many of these serums are marketed with dramatic language, words like revolutionary, breakthrough, and clinical strength, without the clinical evidence to back those claims. The before and after photos and advertisements are often carefully selected with the best possible results shown, not the average result you should expect. Some serums can cause side effects. Prostaglandin-related ingredients can, in some people, cause darkening of the skin around the application area, irritation, redness, and even changes in the color of the iris. These side effects are not common, but they are real. Read the ingredient list carefully. Look up the active ingredients. Be wary of products that make unrealistic guarantees. No reputable product should promise permanent regrowth in 7 days because based on the science of the hair growth cycle, that timeline is biologically impossible. A trustworthy product should explain what it does not do, and what potential side effects are possible. If a product will not answer those questions honestly on its packaging or website, I would think twice before putting it near my eyes. The same logic applies to nutritional supplements marketed for hair growth. Biotin is often the first ingredient in these formulations. Biotin is a B vitamin, and true biotin deficiency can cause hair thinning. However, true biotin deficiency is uncommon in people eating a varied diet, and high-dose biotin supplements, often 10,000 micrograms or more, can interfere with laboratory tests, including troponin, a marker used to diagnose heart attacks, and thyroid function tests. In 2017, the FDA issued a safety communication warning that biotin interference with lab tests has led to misdiagnosis, including one reported death when a patient's falsely low troponin result delayed diagnosis of a heart attack. This does not mean biotin is inherently dangerous. It means you should tell every healthcare professional who orders blood work for you about every supplement you take, even if it seems harmless. Zinc is another nutrient marketed for hair health. Zinc deficiency can indeed affect hair growth, but taking high-dose zinc supplements when you are not deficient can interfere with copper absorption and potentially cause other imbalances. The safest and most effective way to support your hair follicles nutritionally is to eat a varied, nutrient-rich diet and to get tested if you suspect a specific deficiency. Now, let me give you the complete 8-step eyebrow protocol that is easy to remember and easy to follow. Step 1. Stop plucking, waxing, threading, or otherwise removing eyebrow hairs for at least 12 weeks. Let the natural growth pattern reveal itself. If you have a truly wild stray hair far from your natural brow area, you may carefully trim it, but avoid pulling hairs from the brow itself. Step 2. Cleanse the brow area gently every evening with a mild, fragrance-free cleanser. Pat dry with a soft, clean towel. Do not rub. Step 3. Before using castor oil regularly, perform a patch test. Apply a tiny amount behind your ear or on the inside of your forearm and wait 24 hours. If you develop any redness, rash, itching, burning, or swelling, do not use it. Step 4. Apply 1 tiny drop of cold-pressed, hexane-free organic castor oil to a clean spoolie brush and gently brush it through your eyebrow hairs, following the natural direction of growth from the inner brow outward. Keep the oil on the hairs. Avoid the eyelid margin and keep the oil out of your eyes. Step 5. Do not use any other active skincare products, exfoliating acids, retinols, or undiluted essential oils near your eyebrows. Step 6. Take a baseline photograph in good natural light without any eyebrow makeup and repeat every 4 weeks. Compare the photographs side by side after 12 weeks before drawing any conclusions. Step 7. Eat a varied, nutrient-rich diet that includes adequate protein, iron-rich foods, zinc from pumpkin seeds, omega-3 fatty acids from fatty fish, and colorful vegetables and fruits. Stay well hydrated. Step 8. If your eyebrow thinning was sudden, occurs in patches, involves the outer third of both brows, is accompanied by eyelash loss, or is associated with fatigue, weight changes, or other systemic symptoms, schedule an appointment with a qualified healthcare professional and request appropriate testing. This protocol works because it addresses multiple contributing factors simultaneously. It protects the hairs you still have from breakage, it reduces mechanical trauma from plucking, it reduces chemical irritation from products, it ensures your follicles are getting adequate nutrition, and it rules out or identifies medical causes that require treatment beyond what any oil or serum can provide. Now, let me return to Margaret. 4 months after she stopped plucking, simplified her skincare, started the castor oil conditioning protocol, added more iron-rich foods to her diet, and discovered through blood testing that she had low vitamin D, her eyebrows looked genuinely different. Were they the eyebrows of a 25-year-old? Of course not, and she would not have expected that. But they were darker, shinier, less sparse, and the skin underneath was healthy and calm instead of dry and irritated. The oil was part of the story, but it was not the whole story. The real transformation came from stopping the damage, nourishing the follicles from within, and identifying a correctable deficiency. That is the real lesson I want you to take from this video. When an aging concern appears on the outside, the first impulse is often to reach for another product. A cream, a serum, an oil, a procedure. And sometimes those things can help. But the first question should always be, what is happening underneath? Your eyebrows may never return to the exact shape and density they had when you were 25. That is perfectly okay. The expectation that every feature must look exactly as it did decades ago is not healthy, but healthier looking, well cared for brows that reflect a body being properly nourished and protected, that is achievable. And that is worth the effort. Do not let an advertisement make you feel that normal, gradual aging is a personal failure you must spend hundreds of dollars to correct. But equally, do not dismiss sudden changes as just aging, when they may be your body trying to tell you something important. Use the oil carefully and consistently. Keep your expectations